When it comes to kids, many of us overlook certain health checkups, only going to the doctor if something is wrong. What about going in for a checkup to make sure everything's all right? Pediatric cardiologist Dr. Joshua Quiñones with Modern Heart and Vascular says it's a great way to catch potential problems early, even in children, before things can become worse. All right, Modern Heart and Vascular Institute, you see people of all ages, but as we know, most serious heart issues are in adults, and it's still the #1 killer.
Yes, it is. But a lot of these issues can present earlier in kids, and that's why it's important to get checked early.
Yeah, and checkups are life-saving. All right, so you are a pediatric cardiologist, and I know sometimes people go, wait a minute, kids have problems with their hearts, but yes, quite often. Before we get to that part, I want to take a look at your socks right here, because I love this. Look, oh.
Yes, that's my son. He's a year old now.
Oh, well, congratulations.
Near and dear to my heart.
Yeah, so heart concerns in children, sometimes they're congenital, meaning they're born with it, right?
Yes, ma'am. So some kids, when they're developing in utero, something doesn't quite go right, and so they can be born with issues that could be life-threatening. And a lot of those present very early on, and luckily we have the technology now to help take care of them. And a lot of those signs aren't very subtle, but a lot of the other things that can develop through bad habits are a little bit more subtle.
Yeah.
The lifestyle things that catch up to us.
Yeah, even in kids, yeah.
Yes.
And then there's acquired pediatric heart issues, things like rheumatic heart disease, bacteria responsible for strep throat, kind of rare in this country because we can attack strep throat right away, right?
Yes, it usually happens when it's not fully treated, and it can develop later on. Luckily, we're good at detecting and treating that, so it's not something we see from people in the United States too often.
Yeah, all right, Kawasaki disease?
So that can happen as well, yes. It's an issue with coronary arteries, an autoimmune issue where your body starts to attack the heart itself, and it can be life-threatening, but yes, luckily we do have a lot of treatments for that.
And again, a checkup, that's why they're so important.
Yes, ma'am.
All right, the other thing that's kind of new, relatively, is COVID side effects that you're seeing in some kids.
Yes, there was a big rush of, information about COVID, but there has been some lingering issues for some kids, particularly teenagers. And so if you have those teenagers that have subtle symptoms with exercise, not quite feeling right, chest pain, a pediatric evaluation with our heart could be life-saving.
I had a friend, they had to take their 16-year-old in, and they had no idea what was happening, heart racing, and they were so concerned, and they were going through all the checklist of everything, and they couldn't figure out at first, why is this child having such issues? And then somebody asked the question, what'd you have to drink today, and how many? Energy drinks have also become kind of a new concern.
Yes, ma'am. So as a pediatric cardiologist, I don't believe any child needs that concentration of sugar and caffeine in order to function. And I have in my own clinic seen patients coming in with symptoms of blood pressure issues, lightheadedness, racing heart rate, and it boils down to these drinks and these foods that just have such high concentrations of caffeine and sugar that, yes, I can't in any good conscience recommend or encourage any patient of mine to take it.
Encourage a better night's sleep instead, right?
Yes,
all
ma'am.
right. When you mention high blood pressure, there are many things that surprise adults that kids can have, and they're the precursors to heart disease. High blood pressure, high cholesterol, type 2 diabetes. We used to call it adult onset, but because we're seeing type 2 diabetes in younger kids now, it's a number right now,
yes.
right? But all of those things can really attack the heart, if you will.
Yes, so a lot of those start really early with the decisions that we make and the things that we teach our children, the foods that we eat, the things that we let them drink, the type of activity and exercise that they do, the sleeping habits. And unfortunately, a lot of the symptoms can go either unrecognized, or kids compensate so well, they don't show a lot of the symptoms that adults do. And so without routine checks, blood pressure checks, cholesterol checks at your pediatricians or cardiologist, you might not know that your child has these things until it's too late.
What are some of the symptoms, especially in kids, that would warrant a checkup?
Yeah, so high blood pressure, particularly if it spikes rather quickly, can sometimes show up with frequent headaches, blurry vision, ringing in your ears, chest pain, irregular heartbeats, would all be things that would be concerning and warrant further evaluation.
Yeah. And sometimes kids will have symptoms, but sometimes symptoms won't appear unless there's exertion. So if you have a student athlete, your advice for parents with student athletes?
listen to your body, and if you are having any kind of concerns or questions, absolutely get checked. We have different tests and modalities to ensure that every child is safe to perform exercise, and so if there's any question at all, better safe than sorry.
Yeah. All right. So if there's no question, should someone just periodically include this with a pediatric cardiologist as part of their child's checkup? Or only if you have symptoms?
It would be individualized depending on family history and your goals. If you are someone who's pushing to the limits and going for the Winter Olympics starting this Friday, then perhaps getting some type of cardiac evaluation would be warranted. But if you're just a healthy kid playing in the backyard and no symptoms, you're
good.
fine.
Yeah. Okay. When you say family history, I know because somebody had asked me, "Do you have any family?" I said, "Yeah, my dad," when he was like, or my mom when she was like 93. They go, by 93, you're probably okay, right?
Yes.
But when you say family history, what exactly are you looking for that would say, let's just go ahead and make sure that this child is checked?
Particularly any kind of cardiovascular events, strokes or heart attacks before the age of 50. Anyone with any kind of arrhythmia, which would be some kind of abnormal heartbeat. And any babies or kids, siblings that have been born with congenital heart disease that you had mentioned earlier.
Yeah. All right. For any parent taking their child to the doctor, there's a little bit of anxiety there on both sides of that, right?
Yes.
So what does a pediatric cardiologist visit look like in your office? I can already tell that it's a little less scary because you have
Yes, ma'am. I have Lizzie the lizard here. She helps me check my patients.
Okay.
So it's not scary at all. A lot of what I do is reassurance. You'll come in, we'll take vital signs, we'll do an EKG, which is a test that you put stickers and electrodes on the chest, prints out a paper. It gives me a preliminary look at your heart and the electricity of your heart to make sure everything's looking good. I'll go in there, ask some questions. We will, learn about your history and your symptoms. No shots for the kids.
Yeah.
And a lot of what I do is reassurance and making sure that everything is indeed safe and okay.
All right, so as we mentioned earlier, Modern Heart Vascular treats the entire family, so mama, grandma, grandpa, everybody, the kids. So how many moms have asked you, like, while I'm here, could you check my heart?
It's happened before, but I'm 18 and under, so
18 and
yes,
under.
pediatric.
Okay, I just thought while you were here, we could just go ahead and take that stethoscope and check things out. All right, Dr. Quiñones, thank you so much.
Absolutely.
All right, to schedule your child's heart checkup or even a checkup for yourself, now is a great time to get it done. Don't wait. You can schedule a pediatric cardiology visit with Dr. Joshua Quiñones at Modern Heart and Vascular by calling this number, 832-644-8930. Again, that number is 832-644-8930, or visit them online at modernheartandvascular.com. They have 8 locations throughout the greater Houston area.